Canna fam, what's going on? Dr. Dan here at Ozark MMJ Cards. Looks like the live cast today on YouTube was an utter fail again. That's 2 in a row. I'm starting to feel like a real newbie here when it's coming to the YouTube thing, man. This is getting super frustrating. Camera wouldn't turn on again. It seems to work out fine here on my desktop. Anyway, enough boohooing. Let's just jump into it. Originally, what I planned on doing was the adverse effects of cannabis, and I do still plan on doing that. So really, guys, just a couple of high points just to jump in right off the top. Most of the adverse effects of cannabis, guys, when you look at it, all of these things can be reduced by simply reducing the dose. So I just wanted to give the spoiler alert right there, right off the top, including CBD. You'll hear me talk about ad nauseum. The reason for that, the repetitive nature of that message, is because it's just very useful. All right. So with that being said, let me just jump into it. You know, guys, the reason for being careful with the adverse effects of cannabis is that just because it's a plant, it doesn't mean that it can't be abused or misused. Even natural stuff can be abused. So I did just want to point that out. A lot of people will dismiss that, say, you know, it's natural, go have at it. A lot of things are natural and can be quite harmful if they're misused. So first off, THC, guys, is the thing that's responsible for the great majority of the side effects associated with cannabis. So again, the CBD is a good idea. Of note, just to jump into the side effects that you guys can possibly find with marijuana, first and most importantly is the fast heartbeat, the rapid heartbeat. This can last up to from 15 to 20 minutes. This is usually with new users. You'll more often find this with concentrates, things like that are high potency, and usually this sort of thing just subsides with relaxation and hydration. All right, so that's one thing that you can encounter. Another thing that you can encounter is what's called orthostatic hypotension, or dizziness upon standing, and that's something to look out for, especially in the elderly, because they can fall precipitously. So really, guys, the thing that you want to look out for that is rise real slowly, flex the legs before rising when you administer cannabis products. Hydration is also super important to ensure that you have adequate blood volume, such that when you stand up, you're not at a volume loss, and your brain gets adequate circulation. All right. So there's another one, the orthostatic hypotension. Another thing that you guys might want to look out for is dry mouth, right? As many of you know, xerostomia, cotton mouth. That's an easy one, guys. Hydrate. Just stay on top of the hydration. Things like lemony things that arouse that salivation reflex. Lemon peel, lemon drops, gum does just fine. Anything that can elicit salivation. So there's another one. Dizziness, we already went over with relation to the orthostatic hypotension. Really a good thing to make note of, guys, if you can focus on a specific point when if you're seated, and that'll help to orient yourself if you experience dizziness with cannabis administration. Red eyes, as you know, that's very, very common with marijuana. That's due to the vasodilation in your eyeball, and really that's easily approached with Visine, as many of you expert cannabis users know. Visine is always in the arsenal. What else to look out for? Coughing. Well, not much to say here, guys. Coughing is going to come with marijuana administration. Okay. The most logical way to approach that is to limit the size of the hit that you take. Just reduce the hit size. No taking these mammoth hits. Limit just take a normal breath. You don't have to hold your breath when you take an inhalation, right, guys? There's no use, no win in holding your breath. You know, we don't hold our breath when we take in a normal breath to extract more oxygen. No, you're not going to get more oxygen that way. Furthermore, if you take in smoke and you hold your breath, you just throw yourself into a coughing fit. All right, that's no fun. So other things that we need to look out for: pitfalls. There's certain groups that we need to exercise caution with marijuana administration. People with extreme schizophrenia, disorders of orientation, bipolar, those sort of patients, we have to be mindful, because they don't handle the psychoactivity quite as well as other patients. So we have to be mindful about altering their state too quickly. So with those patients, we just have to do judicious cautioning and let them understand that this is a psychoactive medication and needs to be dosed correctly if they're going to agree to take it. All right. Who else? Heart and stroke patients. Now, I do like to touch on this because this is a hot topic regarding cardiovascular disease and marijuana administration. We do caution these patients, even though there's just a small theoretical risk, we do caution these patients with marijuana administration that the cardiovascular effects can sometimes be overwhelming in susceptible populations. Heart patients, meaning they've had a heart attack or some form of unstable angina, or stroke patients where there's a disorder of blood flow in the brain. These patients just have a theoretical risk that it can worsen this condition, so patients always need to be cautioned if they're going to decide to undertake medical marijuana to treat some other condition. Usually it's something like arthritis in that patient population. Also, patients with COPD, they have to be advised that an inhalation of marijuana can, and in most cases, will worsen their bronchitis. Patients with compromised immune function also need to take great care. So these are just some of the patient populations that when they come across the medical marijuana doctor desk, we have to just be extra cautious and explain to them the risks and benefits in taking marijuana. These patients aren't absolute contraindications. Some of them might be, but upon taking a complete history, I can get a better idea of their complete clinical picture and what they might get as far as benefit with medical marijuana versus the adverse effects and what it might cost them in administration. As well, another important patient population, people under 22, they have to use caution with medical marijuana because the high THC concentration can adversely affect the brain development prior to that phase. So it's always recommended to use a CBD buffer in those patients younger than 22, just to mitigate the possible neurologic insult that they can sustain with taking marijuana at that phase. People when they take high dose marijuana at a young age and they continue through later years, they can have cognitive deficits, certain behavioral deficits, that sort of thing. So that's why we caution patients at that age if they're going to decide to take on marijuana. All right. What else? Let me just go through my good notes here. Pregnancy and cannabis, always a hot topic. Pregnancy, with cannabis, generally not recommended in pregnancy due to the risk of neurologic development, maldevelopment in the fetal brain. The endocannabinoid system is very important to neurologic development, as they found through research. So also the consideration that smoking cannabis can possibly lead to low birth weight babies. There's been mixed results with that, but there is that risk, when you inhale anything that's smoke-wise, then you do run that risk of lower birth weight babies. So pregnancy and cannabis, generally not recommended. However, there is pregnancy-associated nausea. So it's not unheard of that pregnant patients will use cannabis for their nausea. That's not really a thing that we try and promote in medical marijuana states, but in places where marijuana is either legal or unregulated, that is something that you'll find, because the nausea becomes intolerable, and they either cannot or will not take prescribed medications. All right. So let's just go over these adverse effects. Short-term effects. The most common with cannabis is anxiety or paranoia, freaking out. And this is usually with newer patients and taken again with high-dose cannabis. This can also happen as a result of edibles. That's usually the way that people can misdose cannabis and get a much higher psychoactivity than what they'd anticipated. When the edible doesn't kick in the first 30 minutes, they'll take another dose. Then in an hour, they'll realize that they've taken far too much. So, what happens with these short-term effects? These are well mitigated by lowering the dose, incorporating CBD. CBD can largely mitigate the untoward effects of THC. Also, the terpenes pinene and limonene. Now, just to get into a little bit of the granular as to what happens with this paranoia type effect, THC interferes with what's called the salience network that assigns relative importance to incoming stimuli. So because we can't grade how important each little quanta of stimuli is in terms of importance, we're seeing a lot of different things coming at us at the same time, and we're noticing a lot more than we should be noticing. We're acknowledging a great deal of stimuli simultaneously, and it overloads our system, so we get anxious and we don't know what to pay attention to, and we tend to blow things out of proportion. So that's what you're going to find with the short-term effects. You can also have short-term uh, slowdown of reaction time. That's also very well noted. That's also in relation to the salience network. People will be focusing on something when they're not focusing on what they should be focusing on. So there's that confusion, slowing of reaction time, psychomotor retardation, hand-eye coordination, that sort of thing. That's well known because it inhibits the transmission of the impulses of the motor reflex. All right. So long-term consequences, guys, just things that you have to look out for. Chronic bronchitis, well established, especially in patients that are smoking marijuana. Worse in patients that also co-administer tobacco products. But chronic bronchitis, well established. When marijuana is used in too high an amount, people can over long time have behavioral issues. That's really not adaptive, especially when we consider that we are humans and we live life communally. So the way how we get around those long-term effects, guys, tolerance break. All right, what happens? The CB1 receptors in our brain, when we're inundated with too high of a THC dose over a long period of time, these receptors go back in the cell. And what happens with the tolerance break? These receptors are given a break from that THC barrage, and they'll express themselves again on the cell surface. We're talking about the central nervous system here, guys. Again, in the brain. Now, it takes about 28 days for with chronic THC use. It takes about 28 days for these CB1 receptors to reset and repopulate in the brain. However, in the hippocampus, I had trouble spitting that one out. In the hippocampus, it takes longer than that 28 days to reset. Okay, so just something to remember. That's the part of the brain associated with memory and learning. So just something to consider when dosing marijuana over the long term. Drug interactions, that's something I don't really delve a whole heck of a lot into. Marijuana doesn't have a whole lot of liver action in what's called the P450 system that metabolizes a lot of our drugs. So there is a theoretical interaction of marijuana products and other drugs that are metabolized through that system, but not to any real appreciable effect that we'd have to really pay attention to. So the drug interaction question in my mind is a moot point. Guys, we've gone over a few things here. I've rambled on. I do want to go over in case of over medication. If you take too high of a dose, you have some sort of paranoid reaction. Relaxation breaths are very, very important. Dr. Wheel, very, 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 very smart doctor. Dr. Wheel recommends what's called the 4-7-8 breath. I just read about this. So inhale over 4 seconds. All right. Hold the breath over 7 seconds and exhale slowly over 8 seconds. All right. That's the relaxation technique, the 4-7-8 breath. Really another important thing in case of over medication, guys, just sit in a very relaxing place. Get plenty of water. Taking some CBD is always a good idea. Don't panic. It's usually not means to go to the emergency room. Most of these things will come and go. I know that it can be unpleasant if someone over medicates with cannabis. It can be unpleasant for anywhere from 3 to 8 hours. Usually this happens with edibles. Again, when people take an edible and it doesn't kick in, and then they take another one, and then both of them kick in much later, what's called a cookie casualty. So just wait it out. Keep yourself hydrated. Take some CBD, something lemony like like a lemon drop, something like gum, something tart usually makes someone feel better. Good idea to just rest and stay in a quiet place. Yeah, that's pretty much it, guys, that I wanted to jump into As far as the adverse effects with cannabis, sorry the live cast didn't work out, but I did want to give it to you guys and upload it as quickly as possible. So thanks again for tuning in. My apologies again for the failed live cast, guys. Love you guys. Check you guys soon. Dr. Dan out.